everybody, and welcome to a short video about phlebotomy or drawing blood on a patient. So drawing blood is certainly a nursing responsibility, but it can also be delegated to perhaps a nursing attendant. Some hospitals employ phlebotomists where they have people that come around to draw the blood. But at any rate, nurses do need to know how to draw blood, and in lab you're going to be practicing on some of our models to see if you can become proficient at drawing blood. So the purpose of drawing blood, I guess I should first say that, we can take blood at the skin level, we can take blood from veins, and we can take blood from arteries as well. Generally, arterial blood sticks are done by some specialized nurses, usually working in an ICU environment where we are trying to obtain a specimen for an arterial blood gas. Blood draws at the skin level, think about, you may have already done this, right, in clinical, maybe sticking a patient's finger to get a glucose reading, right, or sometimes we can even check cholesterol levels by doing a finger stick. But by far the most common way to take blood is that of venipuncture, and that means going into a vein with a hollow bore needle to extract blood. And we can utilize either the vacutainer method or we can use simply a syringe to get the blood that we need. So I'm going to show you some of the different equipment that I have here today. We're going to do a little practice on drawing blood. So first and foremost, you need an order for the blood draw, right? The provider gives you an order. It tells you that they want, let's say, a complete blood count, maybe a metabolic profile, maybe some coagulation studies. And so you have to first gather your equipment. So you need, of course, needle. You need perhaps a vacutainer or a syringe. You need a Band-Aid. You need a tourniquet. You need some alcohol preps or chlorhexidine preps. And you need a gauze pad. And then, of course, you need the tubes that you are required for the blood test. So I have a couple of different tubes here, and basically you'll see that, they pretty much all look the same, with the difference being the color of the top, right? So as time goes on and you get more practice, you'll come to realize that, different colors are for different tests, and they never really change. So no matter where you go to work, if you decide to go work in, Wyoming, you're going to find that the colors on the tubes are exactly the same. So if we take, for instance, this lavender top tube, the lavender top tube is used most commonly for the complete blood count. Now, one thing about these tubes is that they tell you how many milliliters of blood is required for the particular test that you want to do. So if you're utilizing the syringe method to pull that blood from your patient, this tube says that it requires 3 milliliters of blood. If you don't put 3 milliliters of blood in there, then the lab is not going to be able to run the test. And basically what they're going to do is they're going to take this tube, they're going to throw it in the garbage, and then they're going to call you and they're going to tell you that the quantity was not sufficient enough to run that particular test. So you always want to make note of that, because if you don't have enough blood in the tube, then they can't do the test. And again, that's going to mean that you're going to have to stick your patient all over again. Now, if you use the vacutainer method, the vacutainer refers to the vacuum that is already in the tube. So these tubes are manufactured with a certain amount of vacuum or suction that is inside here. When you attach one of these to the actual vacutainer device, the tube literally sucks out the amount of blood that it needs in order to do the test. So if this needs 3 milliliters, the vacutainer will suck out 3 milliliters of blood, and it will stop when it gets that amount. So each one of these tubes, different colors mean different tests, and they also usually need different amounts of blood in them in order to run the particular test that has been ordered. So the first thing is the order, right? The second thing is to collect all of your equipment. The third thing is to now go into your patient. Of course, you're going to do hand hygiene. You're going to wear regular gloves. This is not a sterile procedure per se, but similar to putting in the IV, there are certain components that have to stay sterile at all times, right? So think about, the tip of your syringe, right? Think about the end port of your vacutainer. Think about the tip of the needle. Think about the other end of the needle, the little tubing that's on there. So those pieces have to remain sterile, right? They cannot be contaminated. If they are contaminated, please just throw them out and start all over again, right? Never compromise a patient by potentially giving them an infection because you might have contaminated something. All right, so you go into your patient, you do hand hygiene, you identify your patient by those two patient identifiers, name and date of birth, and then you explain to the patient what you're going to do. Now, because we're drawing blood, we usually aim for a nice large vein, right? Because we don't want to miss it. It's not like when you put in an IV. When we talked about IVs, we said we always start low and move up the arm. When we're talking about blood draw, we usually go to the antecubital space. The antecubital space for most patients holds the largest vein. It's usually close to the surface, easy to palpate, and very easy to get blood from. And when you are having to get multiple tubes of blood, you certainly want a vein that's going to be able to accommodate, right? A vein that's going to be able to give you all of the blood that you need. So once we have determined, sort of taken a preliminary look at where we want to put this, needle to get the blood specimen, now it's going to come time for us to put on the tourniquet, right? So let me just flip this around a little bit, and we are going to place our tourniquet, again, about 2 to 3 inches above where we want to stick this patient. So when we put the tourniquet on, if you remember, we want to make sure that we are tying that slip release knot, that quick release knot, all right? And always be mindful of that tourniquet. Please don't leave tourniquets on for extended periods of time on your patient, right? It's not comfortable and it could potentially damage the vein and surrounding skin. So I don't know if you can kind of see this little shadow here, right? This is kind of the vein that I'm aiming for. I think I'm going to go like right up in this area. And so I'm going to utilize, of course, my alcohol prep, and I'm going to cleanse that area with the alcohol prep for about 20 to 30 seconds. And you'll please keep in mind that you must, of course, let that air dry, right? Never blowing on it, never wiping it off or fanning it or anything else. Now, believe it or not, I don't have any alcohol swabs, so I'm just going to pretend with a gauze pad, right? So I'm going to go, in a circular motion. I'm going to get that clean 20, 30 seconds. I'm going to let it air dry while I prepare the rest of my equipment. Now, the first thing that I think I'm going to show you is I'm going to show you blood via a syringe, okay? So I'm going to collect a butterfly device, so named because it has wings on it. They might not always be blue. This is an example where they're not blue. They're kind of clear. So this is for use with a vacutainer. However, I can easily convert this to a device that I can use with my syringe. So I open up the packaging and I open this up, and this is the end with my needle. There are my 2 wings. This yellow portion is actually a safety device, and I'll show you how to engage that when we're done. Now you'll notice at the other end here, there seems to be another type of needle. It's covered with sort of a gray rubber on the outside. Please be careful because this is indeed a pretty large gauge needle that, can hurt you. So what I want to do is I do want to attach my syringe to this device. How am I going to do that? Well, I need to get rid of this needle. So I'm simply going to twist it off, and that leaves me with this end. That needle would go in my sharps container. I'm going to take the cap off my syringe. I'm going to put these two pieces together and give a twist to the right. And now I'm set to draw the blood. My alcohol has dried. I'm going to have an additional gauze pad sort of right around the area so that when I pull out the needle, I have something to cover that puncture site with. And it looks like I'm good. I'm going to actually put my gloves on. Okay, and I'm going to insert this needle at about a 15 to 30 degree angle. I'm going to utilize these wings to hold on to. Can you see I kind of bent them up so that I'm holding on to those two wings. Remember with the needles, they have that bevel. You want that bevel to be facing you. It allows for the smoothest insertion of that needle. You'll also notice I'm keeping that syringe in my other hand because I'm going to have to pull back on that plunger to get my blood out. So I insert my needle. I see a little blood flashback in here, sort of in that yellow. So now I know I'm in the vein. I never let go of those butterfly wings. I want to keep that needle nice and steady in my patient. I don't want any kind of wiggling around. I'm now going to pull back on my syringe and get the amount of blood that I need. Once I have that amount of blood, I can put this syringe down next to the patient's arm. First and foremost, I'm going to release that tourniquet. Okay, I'm going to take that gauze pad that I had nearby. I'm going to sort of fold it in half, put it right over that insertion site. I'm going to put a little pressure with my left finger on that gauze, and I'm now going to pull out my needle. I'm going to stay just like this, nice and, quiet and still, holding that needle, holding some pressure there. I'm going to have a little peek, and I see that there's no more bleeding, so I'm just going to leave that gauze pad on top because my next important thing is to sheath this needle, right? Because this is a safety hazard. So what you do is you let go of those butterfly wings and you actually pull on the tubing, and hopefully you can see the needle retracting. And it will retract until it snaps into place. Now that needle is safe inside this yellow piece, and all of this is going to go in my sharps container, right? Actually, back up for a second. So sorry. What I'm going to do now is I got to get the blood out of this syringe, right? So let's say I had, 5 milliliters of blood in here. I'm going to take this piece off. This goes into my sharps container. I'm going to put another needle on top of this syringe, and I'm going to put the needle in here and fill up my blood tube with the proper amount of blood as per the tube. How many milliliters does the tube need? Once I've transferred the blood into here, now this goes into my sharps container as well. You need to label your specimens. Now, most places, of course, as you know, are completely computerized, so that when you're using the electronic health record, you click on some buttons and basically it will print out a label that has the patient's identifying information on it, plus the type of test that's to be done. You peel that label off and put it around the tube, and then this tube now goes in a biohazard specimen bag. We drop it in there and we seal it up. And this is what's going to get transported to the lab. Now keep in mind that if you forget to label that tube, again, what the lab is going to do is they're going to just throw that specimen out. They're not going to call you and say, hey, you sent a specimen to the lab, you forgot to label it with the patient's information. No, they're just going to take it and throw it away and then let you know that the specimen was discarded because it was not labeled. So why is that important? Well, if you have a patient who has difficult veins and you find that it's hard getting blood from them, you certainly don't want to have to go back and do it again. So make sure that you label your specimens. Okay, so that shows us now our syringe method. Now let's take a look at the vacutainer method. So we're going to kind of just sort of start all over again, right? Again, I have my provider order, I've performed hand hygiene, I've explained it to my patient, I've gathered up all my equipment, and so I want to show you a couple of these vacutainer devices. So first of all, I'm going to open up two different butterflies, okay? And basically the difference between the two is their safety mechanism and also their end attachment. So here's one butterfly, okay? And again, just like with the IVs, the color of the wings signifies the size or the gauge of the needle. Blue is 22 gauge. So this is a 22 gauge butterfly needle for venipuncture. And then the other one that I'm going to show you is something called a vanish point. Vanish points, that just refers to the safety mechanism. So this looks a little bit different, right? It doesn't look the same as the other one with the blue wings. Sort of has these clear plastic wings. And actually the blue wings are very moldable, whereas these clear plastic ones are fixed in place. But nonetheless, they are there to help you hold on to the needle as you are inserting it in the patient. You'll notice that at this end of this vacutainer device or needle device, that it has another one of those gray covered needles, whereas this one now does not have a needle at the end. But either one can be used with your vacutainer device. So when we open up the vacutainer device, okay, again, making sure that this end stays nice and sterile. So if we're going to use this one that does not have the gray needle at the end, we simply take this cap off and we twist these two pieces together. Vacutainer is all set up, you're ready to go. Now, let's take a look at the other one that has that gray needle on it. So you remember we had removed this when we were working with the syringe, and we're going to do the same thing now. We're going to remove that gray needle, being careful not to touch that hub, and we're going to take these two pieces and put them together, okay? So now we're ready to go into our patient. We have our gauze open, we have our alcohol swab, and I'm going to put that tourniquet back on at about 2 to 3 inches above where I'm going to stick. And I'm going to cleanse that area 20-30 seconds, let it air dry. I'm going to have my tubes very close by. Why? Because I need to be able to insert them into this vacutainer device. So I'm going to unsheath this needle. I'm going to make sure that the bevel is facing me. I'm going to have this vacutainer in my hand, and I'm going to have these tubes very close by me. Let me put them over here so you can kind of maybe not see them a little bit. Okay, so again, same degree, 15-30 degrees. We're going to insert this needle into the vein. We're going to see a little blood flashback. We are not going to let go of this needle. Again, I keep stressing that over and over again. Don't let go of the needles, okay? Because it's, in the rubber dummy, it stays put. I could let go. It's not going to go anywhere. In a real live human being where the tissue is softer, this needle is going to start falling off to the side. It's going to hurt your patient, and it's going to damage your patient's vein. I'm going to set up my vacutainer, I think, right next to my patient's arm. I'm going to grab one of these tubes. I'm going to have the vacutainer in my hand, and I'm going to push the tube into the vacutainer, okay? I'm going to push that tube all the way up and hold it there, okay? And the blood is going to get sucked out of the patient's vein, up this tubing, and into this tube. You remember this particular tube holds 3 milliliters of blood. So once it stops flowing, I know that I have enough blood. I'm then going to remove that tube, and perhaps I need a second tube of blood. I'm going to grab this tube, I'm going to put it inside my vacutainer device. I'm going to push it on. I'm going to collect the amount of blood that I need. Once it stops flowing, I'm going to take this tube out. So I have my 2 tubes of blood. What's my next step? I'm going to release that tourniquet. Release that tourniquet. I'm going to get my gauze pad. I'm going to put it over the insertion site. I'm going to hold a little pressure right there, and I'm going to pull this needle out. And again, I'm going to stay still. I'm not going to be fiddling around because I don't want an accidental needle stick. I'm going to hold pressure there. I'll take a little peek. It's not bleeding anymore. I'm just going to leave that gauze there. And now I want to engage the safety on this particular needle. So this was the one that was called the vanish point. I'm hoping that you can see that blue sort of arrow that's there, okay? That is an arrow that you're going to push this side piece, okay? You're going to kind of squeeze it, and the needle has now disappeared. It gets sucked back into here. So this is, the safety is engaged. We can go ahead and put all of this into the sharps container. Now, just to show you the other one that we had this one with the blue wings, but this one doesn't have that yellow piece on it, right? This also does not have the needle with the gray covering on it. We're going to take this cap off. I'm going to put this together with my vacutainer. And, just as we did before, I'm going to stick my patient. I'm going to put my tubes in here, get the amount of blood that I need, take the tourniquet off, take the needle out. And now this one is very similar to the yellow one. We are going to simply do a little squeeze here, and we are going to move this sheath up over the needle. Okay, so a little squeeze. Both pieces go up, and there's a little click into place, and now my needle is covered, and all of this again goes into that sharps container. Now the bleeding is over here, and so I'm going to grab a Band-Aid, and then I'm going to take care of my specimens by labeling them and getting them off to the lab. Some specimens are going to require a little bit of shaking of the specimen. Some of these tubes have preservatives in them that you need to mix with the blood. So mixing doesn't mean this. We never shake blood because we could be breaking the cells. We want to make sure that we're just doing something like this, right? And there are actually some blood tests that will tell you that you have to do this 10 times or you have to do it 20 times. So you have to make sure that you're aware of all of these little sort of rules about getting certain specimens of blood. Where do you get that information from? You get it usually, there is a poster that is placed at the nurse's station or sometimes in the medication room that's going to tell you what color tube is for what and how many times you might need to invert the tube. If you don't have one of those posters handy, you can always call the lab, right? They're always willing to help. So I'm, going to thank my patient. I'm going to remove my gloves in a safe manner. I'm going to put those in the garbage. I'm going to perform some hand hygiene, and I'm going to take my specimens to the lab, or however your facility gets specimens to the lab. I'm going to make sure that they get there in a timely manner. Again, note that there are some blood specimens that may have to go on ice because we can't have any sort of breakdown of the cells because that could interfere with the test, right? You might get abnormal tests. So keep in mind that, phlebotomy or venipuncture, by gathering these blood specimens, it allows providers to make decisions about a patient's diagnosis. It allows a provider to make decisions about a patient's treatment plan, and it tells us whether or not a patient is responding to treatment that we're giving, right? Let's say you draw blood to measure a potassium level. Let's say your patient's potassium level was low and you gave supplemental potassium. And now the provider says, let's check the potassium level, right? So if it's higher, then you know that the intervention that you did actually worked. So blood tests, are invaluable. And as I think I might have said before, they are probably the most common test that is done in the clinical area, right? Getting blood work done. All right, thank you for your attention. I hope that you enjoyed the video. I'll see you soon. Thanks.